Hello everybody, here we are. Today we're going to do some celebrity arm sculpting, and I'll have Sarah here with me. How you doing, Sarah?
I'm great and excited.
Okay, great. So what we're going to do on Sarah today is sculpting her arms, not just down here, which this is what other doctors do, but we go all the way around. We cover all surfaces, including the shoulder, over the top of the bicep. We'll blend it all the way down to the forearm here. So, as we can see here, Sarah has some muscle. Can you make some muscle for us? She's got a little bit of bicep here, and she's a very fit girl, but we have a little bit of fat here that won't go away. And when we take this away, we're going to see a slimming effect and also a nice cut of her bicep right here. And then Sarah will turn a little bit this way. We can show her. Okay, so can you make a muscle again? Okay, so we can see her bicep, just the contour here. But what we want to see is a slimming and nice cut of her bicep right here. And when we're done, we're also going to see a nice cut of her posterior deltoid, her back of her shoulder muscle, and her tricep right here. So again, here's Sarah flexed, and let's do this for him because we're going to compare this to the after. So here's her before, and great. Do the cheerleader here for us. Great. Let's turn you around. And this is her cheerleader pose beforehand, where we can't see too much of her muscle contour. But when we're done, it's going to look a lot more like this. Okay. So are you excited?
Totally.
Okay. So we'll be coming back right when we're finished with one side so that we can see the difference. So the results are immediate. The skin, which right here is sagging down, is going to pull up, and you may have heard from other doctors that any sculpting you do in the arm is going to result in sagging skin. It's not. We're going to see this pop right up. Make a muscle again. We're going to see that skin pop up and tighten up immediately right when we're finished, and it's going to get tighter even further on after the surgery. Okay, so we'll see you guys in a little bit. Hello everybody. So we're here putting the numbing fluid in, and we've already done a bit. And Sarah, how's it been so far putting our numbing fluid in?
Definitely tolerable, so I know I can get the rest of my body done in the near future.
Okay. All right, so this is what putting our numbing fluid in does right here. So, does this pinch very much, Sarah?
No, actually no.
No? Okay. All right. So this is a similar kind of motion as we're putting our fluid in as it would be when we're actually sculpting. We'll show you a little bit of that later too. Okay. So turn your arm here this way. Okay, let's let go of that. And hold it tight here for me, Sarah. So this process is a very interactive process, which is we've named Interactive Lipo because the patient's actually required to hold their muscles tight.
Flex your gun.
Yes, flex your gun so that I can feel what I'm doing and feel what the muscle is, and I can put things in very accurately, which would be near impossible if the muscles were floppy and loose. Okay, so we've come close to the completion of our numbing process. Then we let everything soak, and at this point we are going to get ready to start sculpting. We'll see you guys a little bit later.
Bye.
Recording.
Okay, recording. Okay, lay your head down.
I know, I just like to see it come out.
Okay.
Can I bring my head up or no?
No, just right now. How you doing, Sarah?
I'm doing great.
Okay. So this is for our audience out there. This is us doing lipo. And Sarah, are you feeling any pain right now?
No, sir.
Are you feeling any stings or burning or anything?
No, sir.
Okay. I'm going to turn your hand in just a little bit and give me a little bit of bicep. Okay, so what I'm doing right now is I'm having Sarah tense up her muscles so that I can control and feel everything as I'm sculpting around them. We're working on Sarah's lateral arm here, which is traditionally one of the areas that doctors are taught not to sculpt, but there's so much definition to be seen right here. The shape of the shoulder, the curvature of the biceps and triceps. So is this anything like what you expected, Sarah?
No, sir.
No, what did you expect?
A lot more pain and discomfort, and I don't know. It almost feels like a deep tissue massage. Like if you like that type of comfort in a weird way.
Okay, and I'm going to open up your arm a little bit. Hold it tight right there again. So the nice thing about having a patient awake, and actually the only way that we can do this type of sculpting is by having her move her arm in all these different positions. They're very critical to get the right angles. And if I had a floppy arm with a patient asleep, there's no way that we could do this. So hold it tight. So this, no, right there, yeah. So right here, you can see how firm her arm is. It's like we're actually sculpting with our arm in a vise right here. And Sarah is being her own vise to hold her arm steady. Okay, so then what we can do is this. Make a muscle for me. Okay, if you can take a look down here, Sarah, you can already see this is starting to thin out on the side. Okay, and then we're going to turn our arm this way. Hold it tight right there. Okay. So there can occasionally be a pinch or two, and I always check with my patient, make sure they're comfortable, and in the case that there is some sensation there that is still burning or stinging, we can add more numbing at that time. And keep holding right there, Sarah. Put it right there, perfect.
The worst part was the lidocaine shots. That was the worst part.
Right, so the bee stings that we had, right?
Yeah.
At the beginning of our numbing, we had to actually numb up a few spots where we make our incisions with the lidocaine injection. It does sting. We call it the bee sting. And that's what Sarah's referring to right now. And hold this tight right here. Keep that muscle tight. Any discomfort here?
It feels weird, but no like pain really. Like just a little tingling. Like my arm's going to sleep, but
so here we are sculpting around the bicep to create more definition in the bicep muscle. Sarah already has very strong muscles there, and as do most of the women that we sculpt on. However, when there's fat in this area, it covers up this groove. Make a muscle. Take a look down. Can you see this? Can you see the groove from there? I don't know. If you can, just swing a little bit this way, Angie. Can you see a little bit of the bicep definition showing? Okay. All right. So
stay flexed?
yeah, stay flexed. So during most of the sculpting process, the patient will have her muscles tensed up. So it is kind of a boot camp in here too at times. Boot camp where you get to see the results immediately. Make a muscle again. Okay, do you see how it's hollowing out right here? Okay.
Keep
Great.
going, keep going. Take it off.
So we'll come back after we finish a bit more. Thank you. Okay, hello again. So we're getting close to finishing up this arm right here. So I've been having Sarah tighten up her muscles here. Tighten it up for us right here. Okay, so we've already sculpted out a lot here. We sculpted around her biceps. So you can see her biceps nicely come up a little bit closer here. Okay. All right, so we've already done a lot on the top of the arm right here, and you can already see this groove as it really is popping right here, and you can also see her bicep a lot clearer. And if you look at this way, it's a lot flatter right here, and it's flatter right here. It's not rounded like a cylinder. It's more of a blade-like shape, like the bicep should be. Tense it up again, and then there's actually a dip in right here which is the underside of the bicep. So all those things are showing up. We're now about to get into the lower arm, and we'll show you that in just one moment. Again, we're continuing, and we're going to be working on the underside of the arm as well as the lateral side of her arm. And as you can see, Sarah is in a different position right now. This is the dynamic nature of interactive lipo. Interactive lipo requires Sarah to be holding her arms in this position right here. Hold it tight for me. So she becomes somewhat immovable. And actually, my nurse is filming right now, but normally my nurse would be sitting here holding her arm and also bracing some things. So we're going to go ahead and start. Sarah, are you good?
Yes, sir.
Okay. So hold it tight. So this is us doing lipo. And if you've ever watched a video with a doctor doing lipo, you see the person's body is shaking all over and it's wiggling and it's jiggling. And when we're doing this lipo here, hold it tight again. I'm going to change the angle, hold it right there, tight, tight, tight. I'm working on a very stable structure here. How's this? Look at that.
Oh, you're watching me? What?
How you doing there, Sarah?
I'm doing good.
Okay, and I think you guys can probably see that her shoulder definition is really starting to pop right now. And as I'm doing this further, it's going to be more and more defined. Any pain at all?
No.
Okay, great. Hold it tight right there. So, this is us doing lipo. This is the first video, by the way, that we've actually filmed.
Whose idea was it?
It was Sarah's idea. So, Sarah is the first to have her lipo case being filmed as we go. And she is wide awake. We haven't given her any sedatives, no anti-anxiety medications. We did give you a pain pill though, right?
Right.
We gave her some hydrocodone, which does not make someone drowsy.
No.
So she's fully awake and fully able to follow all my instructions. Hold your body still and tight. Perfect. You are the perfect patient.
Feel free to use me as a demo anytime.
Okay, hold it tight here. So this is not a vacuuming process. This is a sculpting process, and a sculptor needs to have a steady object to sculpt on. Okay, so at this point I can take her arm, make a muscle here for me, turn it inward this way, okay, and flex it down, out, tight, okay. So you can come in a little bit closer there, Angie. Okay, tighten it up right here, turn it a little bit. So now we're starting to see the nice muscle definition, flex it again. Okay, we're having all these curves starting to pop here. Go back into fingers to fingers. Great. Okay, thank you. We'll show you guys some a little bit later. Hi Sarah, how you doing?
Good, thank you.
Okay, so I'm filming a little bit here, and Sarah, why don't you just tense up your muscle right here? Okay, and flex it back and forth. Okay, I'm going to move right over here. So we just finished up, and we haven't. We're about to stand Sarah up so that we can see everything. So let's turn this way a little bit. Okay, tense. Great. Okay, you ready to sit up, Sarah?
Yes.
Okay.
Oh.
Okay, so scoot over here to the edge of the table here. Okay, so we have the mirror here for Sarah to see, and arm down your side. I'm just taking a look. You want to stand up and
Sure.
so we just touched up that the side of your arm. It looks better now, right?
Much better.
Okay.
This one's like blah.
Okay, so I'm just going to come right up here. Okay, why don't you do the cheerleader pose, both arms. Okay, how does that look to you?
Much better. Much
okay,
better.
I'm standing behind you so we can see that. And then let's come up with the, here we go. That looks great. Look at the size difference in your arms. Turn just a little bit right there. Okay, and just a little bit back. Okay, and I'm going to slide back behind you so that our audience can see this from the back side. Okay, there's your left arm. And turn just a little bit away like that. Okay, give me some flexing. Awesome. Okay, go ahead and turn around and take a look at yourself. Look at your back of your arm, look at your triceps. Not that one, the other one.
Comparison.
Okay. Is
Oh
that
my God,
a tiny little arm or what?
Yeah, it looks like a normal woman's arm.
Okay, and then as you twist your arm back and forth, you see your triceps flexing right there?
Yeah,
Okay, then you bring it up in that muscle pose.
much more
It's
normal.
kind of dark right there, but okay.
Yeah.
Is that what you're hoping to see?
Yes, sir.
Much better. Like I won't even wear tank tops because of this arm.
Okay.
You know, or before.
Okay. Why don't you stand right over here and let me take a look in the. Okay. You bring your arms up to the side here. Great. That arm versus this arm. Come back. Do the cheerleader. All right. This area looks good. Can you turn all the way around for me? Okay. Good. Can you bring your arms up in a muscle pose? Okay. Great. Awesome. Thank you very much.
Thank you.
So, all right, so here we are with Sarah. How are you doing, Sarah?
I'm great.
Okay, so we just finished both sides, and I'm going to come up right here next to you. All right, so how, just slightly turn a little bit side to side. Okay, and back this way. And we were just talking about how much thinner you look, right?
Just
You
from
know?
the front, my profile, my
Right.
shadow's probably smaller.
All right, just from the sculpting. And then you want to do the cheerleader for us, please? Okay, great. And then let's do a muscle pose. Okay, see a lot more of the muscle, a lot more of the definition, right?
Yeah.
Okay, so you want to turn and take a look at your sides of your arms, and you can do the muscle pose there, and go up and show them biceps,
Very nice.
triceps.
My incisions are so tiny, you won't even know.
Okay. Awesome. Give me a double arm pose right here. Okay, perfect. Great, so you can turn around. So, you a bit sore?
A little, but it
Okay.
feels like I just actually worked out.
Okay. So your second side had a little bit of stinginess, right?
A little, but you
Okay.
fixed it
Okay.
fast too.
Okay, great. So here we are, and that's our full thing. So we got our first surgery under film and everything. So I appreciate it.
Of course, there'll
Thanks
be
for coming
more.
in. Okay, thank you. Bye bye.
Thank you.